So again, knowing how to place your ultrasound and toco transducer is important, but we also know that these are heavy, rigid, hard, flat monitor parts that really have not evolved over the years that they have been introduced. The machine itself that obtains that information has changed. We now can take a mom's blood pressure, we can take her pulse oxygenation, and we can monitor multiple passengers. But really what has gone on and is actually applied to the belly has not evolved. And so we all know as providers that to encourage labor and progression, a woman needs to get up, move around, change positions. Because these monitor parts are so heavy and bulky and flat, what tends to happen is once you get the monitor parts in place, now we're encouraging her to get up, move around, change positions. We're going to do a lot of slipping of these monitor parts because they're heavy and bulky. As a provider, I just got so tired of putting these hard, rigid monitors on a woman that I decided to design and develop a pad, very simple pad to use to help stabilize these transducers. And it's called the Addition. And just like the transducers, there are two parts to it. There's a very simple, easy release backing. You just bend your product and remove this backing, which exposes this low tack adhesive. And it's the adhesive side that goes directly on the pressure sensor of your transducer. Now, when you place it on her belly using your straps or a belly band to hold it in place, you're actually getting more of a picture of her contractions. Because of this wider diameter, we see contractions more visibly on the monitor paper. It works great for just all gestational age, and especially for larger BMIs where you really have a hard time getting a nice tight fit to show up uterine activity. So the Toco pad is very helpful for gestational ages of all ages, as well as BMI. Then you have the ultrasound transducer. This is another one that we struggle as providers because once we find that fetal heart tone, we use our straps or our bands to get them in place. Now we're encouraging her to get up, move around. And because of the weight and the bulkiness and as much gel as most providers use, we tend to have this slipping around often. And so even with our bands and our straps, sometimes we just aren't getting that good fit. Again, the Addition pad for the ultrasound is a very simple product. You want to go ahead and bend your backing, exposing this low tack adhesive. And once you've exposed that adhesive, you go ahead and put it on your ultrasound transducer, lining it up. And because of this, you do not need as much ultrasonic gel. Just a little dab will do you for the most part. You know where your baby is lying, and ideally you've done your Leopold's. You go ahead and place it down where you're getting a good tone. Because this is a goggle foam, it's designed to hug the belly. There won't be any slippage. So if you know where your baby is lying and feeling confident, then you should just place that and feel good about the heart tone, and you'll get a nice continual tracing. If you're not sure where your baby is, and I know there's a lot of providers that don't necessarily do Leopold's, they use a lot of gel and kind of slip and slide until they find their heart tone. That's perfectly acceptable if that's how you are used to putting your monitor parts on. But what I would like to then suggest to you is wipe off all that ultrasonic gel that you've smeared all over her belly and the monitor part, and then go ahead and put that ultrasound pad of the Addition on. Now use a very little gel, and where you found your good heart tones, go ahead and put that ultrasound transducer in place. Now you can encourage her to get up, move around, change positions, and you're going to get a good snug fit of that ultrasound transducer, which means a good continual tracing of the fetal heart tones, which means less adjustment time for the provider. Now you can focus on her needs instead of the monitor part needs. So the Addition, check it out, visit the website, and we're happy to send samples your way.